Hi, this is Dr. Jerry Hesch at Hesch Institute, and John certainly is one of the most complex clients I've had in a very long time. Starting with his feet, he does have a little bit of pronation, and so these orthotics are helpful to him, and they give him some nice arch support, a soft arch support, and they certainly give a little extra padding for shock absorption. But what we did was we did an experiment, and we had him try walking by flipping the wedges. The foot person he saw actually put the height of the rear foot wedge on the outside.
Correct.
And so I flipped it and put the 2 millimeter wedge on the inside of the heel. And you experimented and you found out that on the right side, you feel like a 4 millimeters more helpful. Okay, so that's where we started with treating you. And what was the benefit of that?
Well, during my walk yesterday, after the homework was to find which level was best, I ended up with the 4 on the right and 6 on the right and 4 on the left, because I'm a little bit more exaggerated on the right side. While I was walking, I noticed for the first time more freedom and mobility. Just, I don't know if you would call it, like, I can't describe it, but around here I had a lot more freedom and mobility that I didn't know I didn't have.
Okay.
Until I started walking. And
interesting. And the orthotics have always helped you like instantaneously.
They did.
Which is really remarkable because I wouldn't have predicted that. That's a unique response to orthotics.
Really?
Yeah, and I need to add that most orthotics have a 2 millimeter buildup on them already. Our numbers didn't jive, but we talked about that earlier. Right. Okay. Alrighty, so good. So we found a helpful medial elevation of the rear foot, which does enhance raising the arch a little bit naturally. Good. Yeah. Well, I think those will serve you well. It's a little hard to find a 4 millimeter wedge. Sometimes you can find a 2, and you can stack 2 of those, do an experiment. Okay. Anyway, I'm glad that we figured that out. You had really tight ankle joints. The feet didn't lift up into what's called dorsiflexion past 0 degrees. And that would make reduced shock absorption when you walk. Does that sound correct?
Oh, yeah.
Okay. So I mobilized the tali posteriorly in posterior glide and in rotation, and we achieved 10-degree gain on both sides. What did that accomplish?
It felt great.
Okay. One thing. Well, you kind of noticed that you had more mobility, more yes. Mobility in the foot and ankle.
In pointing my toes is where I actually
downward
felt it,
which is interesting.
Yeah, that's where I felt freer.
Okay.
And laying in bed the night before last, like, it was just fun to be like, I can go that far, or not here, but I can go here. That's crazy. Yeah. And
that should stay. It's good for you to stretch your heel cords. The 2 positions of stretching them. I would stretch them for 5 minutes a day for about a week, and I think you'll be fine. After that, probably do it once a week. But be really gentle in the stretch. Okay. Very gentle, because you want to get a little bit release of the very first restriction that you encounter. You don't want to like blast past it.
That's my problem.
Real gentle stretching, very un-American stretching. Yes. Okay, good. All right.
5 minutes?
Yeah, 5 minutes is a good duration.
Nice and slow.
Yeah. Anything over 2 minutes is really good.
Okay.
It seems like it takes that long to kind of readjust the nervous system. Okay. The other thing that was quite surprising, and I think related to an old injury when you struck the hip, how did that happen?
It was a very, very cold day. I went down a water slide. At lifeguard classes. After the class, we went down the water slide once. It was frigid cold, and I jammed my leg on the bottom of the pool deck.
Okay.
And I don't remember if my leg was locked, but it jammed my right side. Okay. And for about a week, I noticed, I was 15 at the time, so I can't remember it very well, but I know that I remember knowing that was not good. but I never did anything about it. I just
Yeah.
kind of was young and just kind of pushed through.
Yeah. Well, what really amazes me is that nobody apparently checked your hip rotation, but they were treating you for back pain. And there's an old saying, check the joint above and check the joint below. Come lie on your back and I'll show what I found.
All right.
I like to evaluate rotation different than the tradition, and we need research on this to validate it. Your left hip had 30 degrees, give or take, of internal rotation when the hip and knee are in neutral. Okay? Now when I take it up to the end range, I can still bounce it. There's still a freedom in the joint. Okay? Every joint should have that little bit of spring and recoil at end range. This one, I could only rotate, to 0. Okay? So I treated that for 5 minutes. We put a piece of foam under the trochanter and all the hip rotators for 5 minutes. And now it goes into 30 degrees or so, and it has that normal kind of soft end feel. It'll spring forward and it'll bounce back. And what did that accomplish for you?
Trying to put all of it together.
It might be hard to isolate that. That was the first day we did the ankles.
The very first day.
And then we did the hips.
And the sitting.
And
the sitting thing, which changed me how well I felt standing.
Taller, yeah.
Yeah.
And I did a scoop on the ankle, and then I mobilized talus and glide and did rotation like that.
Yeah.
So maybe it's hard for you to know. It seemed to make some cumulative benefit.
It might have been what made that freeness that I felt in the walking. That might have been the
could
benefit
be.
of this.
And I think so. I think it did contribute to that, because that would have increased right rotation of the pelvis as you walk, especially as you bring your left foot forward, the pelvis rotates to the right. And you had reduced right pelvic rotation. So I think that did feed into that. Okay?
That makes sense.
Alrighty. And let me look at my list and see what else we found. So lie on your stomach. We found 2 rib joints.
Shirt off?
No, you're fine.
Okay.
That had reduced mobility. And that was rib number 9 around here. When I tried to spring towards the spine, it didn't have mobility. But now I can load it and I can spring it. And the same was true for a rib between your shoulder blades, which I thought was number 5. And that didn't spring either. And then once we restored that mobility, tell me how you responded to that.
I felt like I could twist again, but I didn't notice that I couldn't twist
Right.
before.
Right.
So when I all of a sudden could, it felt like I was not just twisting from here.
Yep.
I felt like I was twisting from here and up.
Nice. Nice.
Which was different.
And it doesn't matter how strong you are. When you have, you can sit up.
Okay.
When you have restricted mobility in a joint, you're going to turn around. When you have restricted mobility in a joint, then the ligaments on one side of the joint are tighter. Same thing for the tendons and even parts of the joint capsule. And that's actually more of a three dimensional phenomenon. Okay, but anyway, that excessive tension causes inhibition of the muscles that have a shared neurology. And so you could strengthen and strengthen and strengthen, but those muscles are inhibited and you can't reverse the inhibition. Okay? I'm sorry we didn't measure that strength. It would have been nice to get that on film, but I just didn't think about it, but I have lots and lots of that on YouTube. It's not commonly appreciated. I have no idea why it's not the case. Okay? And some of these restrictions take a very specific technique, and they take a very prolonged force application to fully correct them. You've had your ribs adjusted prior? In the past, you've had your ribs adjusted? No. How about your upper back? I did mobilize your upper back also.
Yeah, I've had some chiropractors and
popping and cracks and adjustments and stuff for the upper, yes.
But never had the ribs treated. Okay,
Never.
anyway, all right.
Never.
So I've heard of ribs being adjusted, with that quick thrust. But I chose to treat them over the course of 3 minutes because I want to make it not an adjustment that'll need to be repeated, but I want to make it a correction that's corrected once and done. Okay? And I think that when we restored that mobility in those 2 ribs, I then did a manipulation
Yeah, we got lots of
to these thoracic segments. Okay, we don't call it an adjustment. That's kind of chiropractic language. We call it an articulation, and we're licensed to do that as well. Not many PTs do that, but I did, articulate 2 segments, and my opinion is that they will stay mobile because the rib mobility is now restored. So we treat it as a system. We treat the whole body. Okay? Now, for the most significant finding in your body is that of mobility of the sacrum. And we name this a sacral torsion. And the naming might be wrong, and maybe someday we'll have a better nomenclature. It acts as though the sacrum rotates in the pelvis and side bends and becomes restricted. And I have lots of explanations on why that might not be what happens inside the SI joint as the primary driver. But that's not relevant right now. Okay? The point is that when I find someone with this pattern in which it looks like sacrum rotated left, side bent left, the most prominent part will be the left lower quadrant if we divide it into 4 quadrants. Okay, and it'll be lower here. I looked at you and I had you bend forward and it was fine. So I didn't think you had it. But you had this innate sense that you're not weight bearing equally in this part of your anatomy. Okay? Sure. And you talked about when you brush your teeth, all of a sudden you realize your right foot is pointed outward by 10 inches. Mm-hmm. Okay? And you've consciously tried to overcome that, but it's an unconscious thing, right? You haven't been able to change that behavior.
Sure.
It's driven by a reason, and it has to do with the interoception, your body's proprioception, your sense of position, and your sense of movement as well. Your body knew something was just not quite balanced, and that was a way of trying to seek balance. You were always unweighing this part of you're always leaning to the left more so than the right. God, correct?
Yes. Oh, yeah.
Okay. What was really interesting was that I had you bend forward, just bend forward, keep going, stop right there. And there was no torsion. I could easily spring here, all 4 quadrants, and I could easily spring, vertically, even with my thumb, and I could get force translation with a small amount of force. But when you flexed all the way, so go ahead and bend forward all the way, right there is where this torsion manifested. Highly unusual, but you had blocked motion here, whereas on the right side, it was easy to spring through the SI into the rest of the body, into the hip, into the lumbar spine. But it was blocked here. You felt it, I felt it. Same thing with springing vertically under the ILA. It was blocked on the left. And so the way I treated it was I had you lay on your back. I put a firm dowel under the left sacral quadrant, and I had you hug your knees just enough to maximize pressure on that dowel. And you did that for 3 minutes, and that restored the movement. And this is a pipe foam with a wood dowel inside of it, a 1/2-inch dowel. And then we dip it in this rubber dip, which strangely is called Plastidip. We do it 3 times and stand there like a monkey waiting for it to stop dripping, but it makes it'll last, a very long time, and it, before the foam breaks down. Mm-hmm. All right, so it was placed right there. You laid on your back, you hugged your knees were, thighs were bent maybe 100 degrees or so. And it worked. Mm. Tell us what happened after we restored that movement.
I felt, trying to remember my exact words, I was kind of, it was a big moment. I remember over here bending over to pick up my shoes, and
Yes.
I felt like I wasn't stuck in a rounded, scooped forward position.
Yep.
I sat down, picked up my shoes, and I said, "Oh my God." What did I say when I first walked down the hall? Like, my memory's not.
You felt like your weight bearing was balanced.
Yes, I felt like I was actually. Oh, and it didn't feel. It was smooth. The weight transfer was smooth. I didn't feel like I was dropping weight on this side, then dropping weight on this side. I felt like I was skating more than plodding.
Beautiful, beautiful. And did you also report that when you would do like a deadlift that your body would like twist a little bit?
No.
No, you didn't.
I haven't deadlifted for years because I can't.
Okay, so I'm confusing you with somebody else. But you had some movement, did you not, where your pelvis kind of twisted or your trunk twisted, or am I wrong?
I asked you if baseball swinging could be part of the rotational.
What brought the pattern on, possibly? Yeah. Okay.
Because that's only. I mean, as a right-hander, you only bat from one side, so you
True.
only do that one rotation.
True. Right. Yeah.
But I haven't played baseball since 2009, so.
Yeah. Alrighty. So let's just sum it up, and I will teach you a self-treatment for everything that we did with you, so you won't have to come back and see me. I don't think these patterns are going to come back, but we're going to make sure they don't come back. Okay? So I'll teach you real specific ways to self-mobilize those areas. And you'll be able to tell by trying to mobilize them. If it feels therapeutic, then you'll proceed and self-treat. If it just feels like you're laying on a foam dowel and it's not doing anything, then you don't need to do it.
Okay.
So we'll teach you that for your ribs and for your sacrum and for your hip. The ankles, by just stretching your heels cords, you'll be fine. The gain in the ankle motion is restored every time you walk, so it doesn't need to be repeated. Okay. If you wore boots for 40 hours a week, then I would have, I would be sure to have somebody mobilize those for you, but that's not the case. All right, so can you sum it up for us and tell us about your experience coming here? What do you think the future holds?
Oh gosh. In summary, everything's been what I've been searching for. I've been playing this self-diagnosis online game for 6 years. It got really.
Why? I mean, why you doing the self-diagnosis?
Well, I've got nothing bad to say about the Navy, but when I was in, the PT didn't help me, and that's when it started to get bad. And I was like, I'm the only one who can help me. I don't know. Words don't make sense.
But you're trying to help yourself.
Trying to help myself, and that's natural to me. And I found so many different things that gave me relief for a very short time.
Oh, sure.
I took a ball and would roll it on my piriformis and thought I had.
All right.
So basically, the experience here has been, I got answers. I talked to someone who knew what the hell they were talking about and could notice something and say, oh, this needs to be unlocked, this needs to be changed, and we're down to millimeters of glide and angle and stepping and posture and sitting and inches on the chair. Like, it's what I've been looking for. I'm glad you have a YouTube channel, because that's where I was doing a lot of my looking.
Yeah, and it reinforces, I think, the value of doing a whole body assessment on a person. And I'm not talking about posture, I'm talking about a whole body assessment, not of gross movement, but of these small micro movements of the sacrum, or motion through the sacrum, mobility through the ribs, through the ankles, etc. I think by putting all the pieces together, but looking at ergonomics, how do you fit in that chair? And I'm just surprised that was missed. And looking at your hip joint, because really we're supposed to look at the joint above and the joint below, right? And you had them evaluate the pelvic joints, so the next joint below that would have been the hip joints. So it's interesting. I'm very optimistic for you. You've been a very complex case. I mean, I almost missed that thing that we call torsion of the sacrum. We can debate about it later on, but apparently treating it had benefit for you.
Yes.
Now we can debate the mechanics, later on, but for you, treating that was very meaningful.
That was the crown jewel.
Nice, and I thought so.
Mm-hmm.
I thought so too. So I'm going to also teach you some very safe, gentle movement, and I think sometimes our bodies need gentle, safe movement. And there's this overemphasis on quickly go to the core, work on the core. Well, when you went for all that core strengthening, you were incredibly strong.
Mm-hmm. Absolutely.
Right? Tell us, elaborate.
It made no sense to have a six-pack and have my physical therapist say...
You're talking about an abdominal six-pack or like...
an abdominal six-pack, like
Yeah.
a visible, take your
Right.
shirt off, that guy's ripped kind
Right.
of six-pack.
So how... Yeah.
And then to find, a PT who just says, okay, so what we're going to start with before we do anything is we're going to do some core strengthening exercises for the first 3 weeks.
Okay.
And you're like, what? Are you kidding?
Yeah, that's just so counterintuitive. I'm more for test it, and if you identify a real weakness, then go for it. But on a person who's quite fit, I don't think that's the best. That might not be the best income. Well, history has shown us with you. The history has shown you that really wasn't what you needed.
Yes, for me that was true.
Yeah. So I'm very optimistic. I look forward to getting long-term feedback from you. If you have any questions, you need to contact me, and emails can drag a couple of days behind, but if I fail to reply, send me another, or better than that, just call me.
Okay.
So I'm pretty free most early mornings Mountain Time, and I'm usually free after 3 o'clock in the day. I work a light schedule.
Great.
Weekends are
Thank
great.
you.
You'll reach me on weekends too.
Okay.
All right.
So I'm looking forward
Any
to...
any final thoughts?
I thought of something a minute ago, but I forgot what it is. But this has just been phenomenal. Yeah, that's the word. I always felt like I was fixable, but that there was a complicated combination. I was a lock that wasn't just a key. You had to twist me to the left, twist me to the right, 3 times this way. And when the combination was figured out, I knew I'd be fixable. I felt that. I didn't feel like I had a disease or something.
Right.
But no one could fix me. So that's my final thought, was I felt fixable, but I couldn't find someone to fix me. So
How long have you been disabled?
the last 2 years, drastically.
That's pretty challenging economically.
Yeah.
You had a story. You bought a Corvette. You bought a dream
I
car.
bought my dream car, and then I couldn't keep it because I lost the job that allowed me to afford it because I couldn't sit. I worked for 2 weeks in training.
Are you getting therapy now for your car?
I should. I walked across the parking lot on like my second week of this new job, and I was standing in line at Wendy's, and I was trembling standing there. I couldn't wait the 3 people that were ordering in front of me. I had to go sit down before and wait my turn,
Incredible.
And that's when I left my job this time last year.
Yeah.
And I've been looking for answers, continuing since then. The year before that, COVID, everyone was at home. It was really hard to get seen for lower back pain in March of 2020. Like just VA stuff.
Right.
Everyone's focus is all COVID. So it was really hard to just see people and get
Sure
answers and do
Sure.
stuff. Yeah.
Sure. So what do you see the future? What do you think the future holds?
Oh, I think I'm gonna get used to being right, and the sky's the limit from here. I think feels like it.
I'm very optimistic.
Yeah.
And you may have a setback here and there, but you'll have the tools to come out of it.
Right.
So based on my assessment, based on what I've seen over the last 3 days, I share that enthusiasm. Thank you.